Good evening. I'm Steve Schultz, and tonight our co-moderator is Corvallis Advocate, Editor-in-Chief, Stevie Beiswanger. Welcome to tonight's Cityspeak Forum. This evening we will be focusing on city and county responses to the pandemic.
Do a little shout out of, I'm proud of this community, the state as a whole, but in particular this community. One, the community as a whole has embraced this stay home, stay healthy, and worked to try and maintain that social distancing. And then there's all the groups that have sprung up to help others in all of this. I mean, we early on, and I believe still have some unmet demand for personal protective equipment. So that brings me to the one I wanted to really highlight was the Corvallis Sewing Brigade, which spun up out of a group of volunteers to make masks, do patterns for masks, and then begin to recruit more and make more masks. 1,300 members to that group now, which is a key part of the social distancing that I want to emphasize to everybody as we're sitting here in this flattening in Oregon. The flattening the curve has occurred, but it is still a time where we have to protect both ourselves, but more importantly, the rest of the community. Finding our way out of this total shutdown, and it will take time, but in my mind, we have to do it carefully, measured responses, and you'll hear me keep saying this. I think we'll all hear more from the governor this week about where the state is going with its steps to move forward. But that's me of then, now, and on into the future.
Most of the sessions at that NACO conference in DC in early March were about the epidemic, not yet a pandemic. We had guest speakers from the CDC, and they were all emphasizing the fact that it was not, the federal officials at that time were emphasizing the fact that it was not that serious, that we were going to be just fine. But you could hear the tension, you could hear the fear in their voices, and so it was a palpable feeling of, okay, what's going to happen next? The same was true on Capitol Hill when we visited with our representatives and our senators. So by the time I came home, I was ready with a lot of questions. Our core focus really was to do as much prevention work as possible, get as much information out as possible, and to support our healthcare system so that we didn't have a surge here, and also to make sure that we were doing everything we could on the public health side to do all of that contact tracing that you no doubt have heard so much about on the radio or on TV news. And the third priority was to protect our vulnerable population, respect to the homeless population, and making sure that they can shelter and stay clean just like anyone else. So it's going to take time, and it's going to be really hard work.
Pretty early on in my joining of the EOC, it became really evident that we needed to have some focused target areas that we were going to work on in order to achieve any of the work. It was a little bit slow going to get it up and organized in a meaningful way. So it took a little bit of time to put all those pieces of the puzzle together. Again, none of us have ever done this before. It really is a learning experience and trial by fire, but I think we've gotten some good headway now and are making some good progress. McCarthy indicated, yes, there has been some bumps in the road, which is to be expected, some growing pains, but it really has functioned very well. In terms of where we were at a month ago or 6 weeks ago compared to where we're at now, I would say it's night and day. We've done a lot of work. It's been a good learning experience. And I feel like this is something that has built some really strong relationships between the city and county and things that we can definitely build on in the future.
Yeah, it's interesting, the introduction of when this started in early March. What were you thinking? In my world, I supervise our communicable disease investigation unit, and my world has been sort of trying to scream at the top of our lungs for 25 years that a global pandemic was inevitable. We had no clue what bug it would be or when it would happen, if it would be influenza or some other newly emerging pathogen, but that was a common theme in both local, state, national, international infectious disease. And so my world lit up in early January, actually Christmas time. We know that Corvallis really would be as susceptible as anywhere in the world to something like this. We've got an international research institution here with researchers, with students, with faculty traveling all over the world, literally every day. We've got a Hewlett-Packard plant. They've got institutions, they've got bases, they've got business all over the world. And we've also got an incredibly well-traveled population. And we routinely get, cases of exotic illnesses that people have picked up all over the world that we have to deal with and the medical community has to deal with locally. So we started talking within our systems, in the medical system, in the public health world, really at the end of January, early February. And among our first partners in discussing this was Oregon State University. We partnered with them very closely, and we had discussions then about the ability or inability to monitor various travel and what we would do, and if and when a case were imported or exported, what the level of surveillance and intelligence was. At the end of an event, it'll be impossible to know if we overreacted or did too much, but it will be glaringly apparent if we underreacted or did too little. And we have an official count of 28 cases here in Benton County. I don't think there's anyone in the medical community, certainly not in the public health community, that thinks that that is the total number of cases that have ever occurred in Benton County. There are many times that, fortunately, the vast majority of those cases have either been asymptomatic or very, very minor. We have flattened the curve. We've been able to prevent the sudden surge of cases and overload the medical system, and hats off to everyone in the community. Steps, because we're going to be stuck with this virus for months or potentially years to come. This may be an annually circulating event, and that we'll have to deal with like a bad severe flu every year. That we have to keep up this effort. So the motto in my world is WAIT. WAIIT. We're all in it together. We have to hang together. And the analogy I've heard posited around this is opening everything up, recongregating, gathering together and acting like it's January again all of a sudden right now would be akin to cutting the cords on your parachute at 2,000 feet because, hey, you've slowed down your fall. Why do you need that thing anymore?
We had decided on an aggressive path. We were starting up our 27 priority teams that we had identified for this year. We had all of our initial meetings, all the tactical objectives set, and the wheels were really starting to turn on those come COVID. At first, we're like, okay, we're going to monitor this. This is a real thing. But we can keep a lot of this going. We can keep our schedule. We'll be able to manage this as a department. I want to give shouts out to both the city and the county. Having come from a very large metropolitan area, we did no EOC training until we had a major event in 2017, and we had to run one for 3 months. And it was post that event that they really started doing the training. So when I came up and found out that we were committed to EOC training from both, and there was approximately 100 people between the two jurisdictions that were attending these trainings on a monthly basis, I was very impressed that that type of commitment had happened. In the end, it was very smart to do it. And